About 99.9% of patients who are hospitalized with COVID-19 today have one thing in common. They're all not vaccinated. And as the Delta variant becomes more of a threat, doctors continue to encourage everyone who is eligible to get the vaccine. Dr. Albert Holt is the Chief Medical Officer of Memorial Hospital and joins me now this morning. Good morning. Thank you for being with us this morning.
Thank you.
What are you guys seeing at Memorial Hospital right now when it comes to COVID-19 cases?
So we're seeing the majority of patients that we're seeing, particularly for COVID hospitalizations, are all unvaccinated. So we're seeing exactly what the rest of the country is seeing, in that patients admitted for COVID symptoms are unvaccinated patients, unfortunately.
And do we know if the new Delta variant strain has hit Jacksonville here? Are you guys seeing that at all at Memorial Hospital?
Some of the hospitals in the area are checking for the Delta vaccine. We don't have the capability to do that right now, but we know that the Delta variant is present.
And you say that a majority of the people you guys are seeing are unvaccinated. We now have this Delta strain. What is your message to people about the COVID-19 vaccine with those two things being said?
So we know that the vaccines are effective against the variants, and we know that the variants have multiple different kinds of capabilities to them. And so the reason that they classify them as variants is really around how infectious they are, whether or not we have therapies that can treat them, and whether or not the vaccines are effective against them. And we know that the last thing, vaccine effectiveness, has been high against all the different variants.
Can you explain what a breakthrough case is?
Sure. Breakthrough cases are for when patients who've been vaccinated. And so fully vaccinated patients are people who have received either both of the vaccines, if it's a Pfizer or Moderna vaccine, or the single vaccine if it's a J&J vaccine. 14 days after that, they reach their full immunity. And if they have a breakthrough case, that's someone who's either symptomatic or asymptomatic with COVID.
Okay, very interesting. And what have critical care physicians been doing with these COVID-19 patients? I know at the beginning of the pandemic, we heard a lot of times about the ventilators.
Right.
What's being done now?
So we've learned a lot in the past year, and what we've learned has been very aggressive therapy early on helps to prevent patients from requiring mechanical ventilation. But we are seeing patients who continue to require mechanical ventilation despite the therapies that we're using. And so, for example, we have patients now that are in their 30s to 60s who are on ventilators with COVID who haven't been vaccinated. So we definitely would recommend people to be vaccinated, obviously, because of what we're seeing in the hospital, what we're seeing in the community.
And I know with the Delta variant, there's been a lot of talks, a lot of rumors of, does this vaccine protect against the Delta variant? How effective is it against that variant?
We know it's as effective against the rest of the variants as it is against the Delta variant. And so the issue with the Delta variant is the infectiveness of the Delta variant. So it's easier spread. And so it's less effective with regards to things like the monoclonal antibodies that we had, like bamlanivimab, and so the other monoclonal antibodies. And so we know that, for example, it's been effective. And so we would, again, encourage people to get vaccinated.
Great. Well, Dr. Holt, thank you so much for being with us this morning.
Thank you.